Recently at St. Thomas Church in New Jersey took place yet another important and informative medical workshop organized for the community by AAHPO. St. Thomas's Church Cultural Committee Chair Lady Talar Sarafian thanked the panelists for taking time to attend the event. The president of AAHPO, Dr. Lawrence Najarian, read the opening remarks and thanked the church for opening its doors to this important workshop. He also thanked members of AAHPO and the three speakers of the day, Dr. AAHPO, Dr. Lucy Tomasian, and Dr. Terok Alajian. Dr. AAHPO's lecture was focused on diabetes. He began with statistics showing that 13% of U.S. adults suffer from type 2 diabetes, with 27% over the age of 65, and 35% are in pre-diabetic condition. Dr. Achemian described what happens in type 2 diabetes, which affects 90 to 95% of people. He spoke of the symptoms of the diabetes, including excessive thirst and appetite, unusual weight loss or gain, fatigue, blurred vision, slow healing sores and cuts, and more. He also touched on the topic of the complications from the disease. He then spoke about healthy eating, presenting several important slides, visualizing food that are beneficial for people with type 2 diabetes.
When somebody has diabetes, we also not just rely on this, we rely on their blood glucose readings. The new monitors are very effective, whether it's the Dexcom, the Freestyle Libre system. You know, when they eat food, they can check their sugar, they can see the spike. That's their glycemic index right there, so they can monitor it themselves. Physical activity or exercise can both prevent and treat diabetes, so it's important in both cases. And exercise helps diabetes even if it's difficult to lose weight. So if you're exercising and not losing weight, don't despair. You are getting the benefit. It has physical and emotional benefits, but exercise does something to the way the fat is distributed. It reduces the inflammatory fat release. It can be very helpful. The goal is to get at least 30 minutes of exercise 5 days a week.
Dr. Achemian also spoke about medications and its benefits as well as its side effects.
So, for example, we use metformin because metformin improves insulin sensitivity. So it allows the muscles to take up the sugar better. It also tells the liver not to produce more sugar into the blood, so it reduces what we call gluconeogenesis. So that's why we use metformin. It's not for everyone. There are side effects, there are restrictions, but the reason why we use it is because of its mechanisms. Another class of drugs are the sulfonylureas. These are, you may have heard about glimepiride or glipizide, glimepiride. Those are older drugs, but they don't improve insulin resistance. They do allow the pancreas to produce more insulin.
After the presentation, audience members had an opportunity to ask questions. Dr. Lucy Tovmasian lecture was focused on importance of annual women exam and what type of screenings the average woman needs.
The annual well woman exam, what does that entail? The first part of it is a history. Everyone's getting a thorough history. That's the most important thing. That's how you identify risk factors, and this history is a lot of how we decide how often to screen you comes from this history, your family history and your personal history. A physical exam, the most important that we do are the breast and pelvic exams. I also check thyroids, I also check a bunch of other things, but these are the two that are very specific to what I do. Any laboratory testing, which would include pap smear, blood work, whatever else we have to do, and imaging. So when to start seeing a gynecologist? This is a big question. If there are any issues such as delayed or precocious puberty, someone gets their period too early, someone gets their period too late, having any kinds of difficulties, sometimes younger girls who are having difficulty controlling their acne, they get sent to me because of hormonal issues. So when you start is very different for each person. I usually say the latest a girl should start is right before she goes to college. We do a lot to help young women gain confidence in themselves.
She also discussed pap smear and mammograms screening guidelines, as well as bone density screening. Dr. Tovmasyan also spoke about the importance of colon cancer screening.
The age changed from 50 to start colonoscopies and screenings for colon cancer to 45, because there has been an uptick in colon cancer diagnosis between 45 and 50. So even without risk factors or family history of colon cancer, in general, we're starting at 45 instead of 50.
She concluded with her thoughts about the importance of seeing OB/GYN every year. The third speaker of the event was Dr. Dro Kalaijian. In highly informative and personal presentation, he spoke about weight loss control and the benefits of low-carb diet versus surgery and medication.
This is me as a 350-pound, always hungry, pre-diabetic doctor. That was me 10 years ago. And this is a picture of me running a 5K, and I'll be running with my office in a month at the AAHPO 5K. I did this without drugs and without surgery, and I had to ignore most of what we commonly accept in the profession.
He presented a graph showing the level of obesity in US, which in his words is becoming epidemic, and spoke about prevalence of diabetes in a country and in our community.
Less than 10% are metabolically well, meaning they're actually healthy people with no issues, no waist problems, no blood pressure problems, no triglyceride problems. And this is our community. I mean, you see it if you go to church, if you go to, we had the AAHPO Olympics, and you go there and you see we're all suffering, right? All of us are suffering.
During his presentation, Dr. Kalaijian spoke about the changes that was made to CDC website based on his recommendation.
This has been the message for the last 50 years. Count your calories, eat this pyramid, and you'll see at the pyramid, up until I protested, the CDC had on their website 8 months ago that diabetics should get half of their calories from carbohydrates. This has been the message for the last 50 years. And I led a campaign to say that this is ridiculous, that diabetics should not have half of their calories from carbohydrates, and they actually changed it. 8 months ago, I got the CDC to change their website, which was old and inaccurate, because it said 55% of the energy should come from carbohydrates. It shouldn't. But this is the pyramid that we were told, that we said eat a lot of grains, and you see meat up there and fish up there. You should have very rarely cheese, very rarely, right? But this is a problem for people with diabetes, and this has been converted to the MyPlate. And the MyPlate, if you look here, 50% grains would kill my patients with diabetes, right? Because our modern grains, when you go to the supermarket, it's Oreo oatmeal and kashi with Fruit Loops, basically, okay? So this is a problem. We have to adapt, and we have to admit that maybe what we've been saying hasn't been working. This problem has been getting worse and worse.
Dr. Kalaijian described the work he's doing with companies to help their employees maintain healthy weight and be overall healthier.
Our employee wellness program, we've actually taken employees, they don't know me, right? They come to our program and we give them diet education, we give them a continuous glucose monitor, we give them remote scales that we can track, we give them an app where they can become a community that's trying to lose weight, and we monitor them. And we've shown that we've been able to be as effective as these new very expensive medications. And so we've gotten a bit of coverage, and this is just our own employee wellness program. Now we have 3 ongoing employee wellness programs. So I'm very proud to sort of stand here back where I was a 13-year-old playing basketball and say that I'm making a difference. It makes me very proud to say this here.
In conclusion, Dr. Kalaijian shared several musts for any lifestyle plans. They are manage hunger, manage cravings, manage feeling of deprivation, and manage social situations. Dr. Larry Najarian spoke about the leading cause of preventable blindness. During his presentation, he spoke about the ways diabetes affects the eye and risk factors that can cause macular degeneration and how to prevent it.
This next picture shows diabetes in the eye, and I'm showing this not only for the diabetes, but also to show you the macula. On the left is a normal eye, and on the right, we see those yellow spots. Anybody have an idea what those yellow spots are? This is a diabetic, and what happens in diabetes, the glue that holds the blood vessels together breaks down, particularly after 10 years. And the blood vessels begin to leak. And this is why diabetics get peripheral neuropathy. The nerve is damaged. The blood vessels aren't supplying the oxygen. This is why people have heart problems and strokes. And what we see here in the eye is the blood vessels are no longer functioning the way they should. So they're leaking. And you're actually looking at body cholesterols that are leaking out. And they form a circle around the most important part of the eye called the fovea. Remember that tennis ball? That tennis ball is in the middle of that circle on the left. This person is not aware they have a problem until they lose their vision. And that's why this is a preventable disease. When we see something like this, we jump all over it and you get treated right away to prevent unnecessary vision loss.
He also spoke about important study about age-related eye disease, amongst other topics.
In 2005, the treatment was pretty much standard. We would treat with laser, and unfortunately a lot of people lost their vision. There really wasn't too much to say about prevention other than stopping smoking and exercise. But around 2005, a lot of different things began to happen. One of them was a study called the Age-Related Eye Disease Study. We call it ARIDS, and there were two studies. And basically what it found was really quite remarkable, and that is what we eat can impact the health of our eyes. And in fact, the team found a very specific formula of vitamins, a combination, which you see here, called the ARIDS-2 formula. And this specific formula was found to reduce the risk of this condition getting worse by 26%. Now, 26% is not 80% where we would like it, but 26% is better than what we had, which was 0. So even to this day, we recommend if you have macular degeneration, like I showed you in the pictures, taking this vitamin is very, very important. Every day, twice a day.
Once again, AAHPO event has brought much needed medical advice and information to the community.